we kind of dabbled in sleep before. In the beginning of 2020, for the most part, we were doing about 5 to 7 appliances a month. And then towards the end, we were doing closer to 5 to 10 appliances per month delivered.
Okay.
Um, and then we knew we needed to kind of bump it a little bit higher and find some other means of finding patients. So that's where we found dental sleep profits.
You've been in dental sleep profits for about 30 days, 20
Give or
between
take.
29
Yeah.
and 31.
Yeah. Yeah.
What has been your guys' experience so far?
It's been phenomenal. Um, the opportunities that we're getting are just amazing that we wouldn't have gotten otherwise. And it's just given us a lot of exposure. I don't think I told you we actually had one patient of our own dental patient make a comment on one of the ads and say, "Oh, he's been my general dentist forever, and now I'm going to need to talk to him about this."
There
Um,
you go.
so it's gotten amazing exposure all around
That's
for sure.
great.
I did a double consult at one point because
There
she
you
wanted
go.
it, and then she kind of sat in the back, actually pushed her husband in first, and then sat in the background and said, "You know what? I think I want to do this too. Can I send you my information as well to check and see what's going on?" So yeah, it opens different opportunities
Yeah.
that were not there
That's
before.
so cool. And then as far as, because a lot of your guys's the appliances you were providing were coming as a result of referrals from local physicians.
Yeah.
How has dental sleep profits impacted the way you deal with local physicians at all, or that dynamic?
Yes, so a lot of times just to make sure that all of our ducks are in a row to bill to the medical where we need the referral and the sleep study and all the paperwork, I would have to call over to their offices after they've reached out to us and ask for the sleep study. And then in the same time, on the same phone call, I'll ask them, "So what do you do with other patients? Because this is one of your patients that reached out to us for a different solution. What do you do with other patients you might have?" So it's opened other opportunities, I'm sure.
That's great. So it's kind of opening up the opportunity with more primary cares just because you're seeing more of their patients.
Exactly.
And then over the last 30 days, what have the results been for you guys? Maybe in the way of just number of opportunities or number of cases moving forward? What's that been like?
So we've had about 60 opportunities and 60 opportunities that came in from the advertisement. Like I said, some of them are even double opportunities because the spouse also gets involved as
Yeah.
well. And then we've moved probably around 20 to 25 of them over to consult status. And then Monday, actually, we're going to be delivering our first patient. So within 30 days, we're delivering
Delivering the
appliance.
appliance, actually, which
Yeah.
means that patient actually came in probably 3 weeks ago.
Yes.
That's
Yeah. He
awesome.
was super excited to find another opportunity, another option because he wasn't sleeping.
So a big part of what we offer on the back end of the marketing is a way for you and your staff to manage those opportunities with our lead management dashboard. What has your guys' experience with the lead management dashboard specifically been like?
It's great just to see at a glance where everyone is. You know, if you've gotten a discussion that comes through, I just realized something new on my computer that the emails can pop up on my as notifications. So that's actually really neat. And just has a nice clean way so that people don't get lost. And then the notes feature in each opportunity is great so that, you know, you can remember if there was something specific that they said, you'll know how to, you know, remind them of that was their trigger point and that was what was
Yeah.
excited when they clicked the ad.
Yeah. So you're kind of able to tee up that patient for the next person they're going to be seeing in the process with you guys.
Yes. Yeah.
Yeah. That's awesome. Okay. Well, what would you say to someone who has been seeing Dental Sleep Profits ads like you guys have, or has received a letter from us?
Yeah.
And they're on the fence? What would you say to them?
Do it.
Just
There's
do it.
nothing
Just like
else. Do
Nike,
it.
just do it.
Just do it. I think the sky's the limit. Like, I think it will become a larger part of our practice. And in that, we're helping more people. And just, you know, it helps. And it's helping the community around us.
And it's something you had told me before that I think was important to point out. A lot of the patients that are reaching out to you have already had sleep studies done. They're CPAP intolerant, right?
Yes.
Has that been your experience with most of the patients?
A lot of the patients are like that, because they use their CPAP because they think it's the only option.
Yeah.
And then when they see one of the dental sleep profits ads, all of a sudden it's like, wait, there might be another option, and this actually kind of is more compact and more user friendly, and I don't have to clean a million tubes and wait for refills. And I was that person when it came to signing up for dental sleep profits, and it works. And it's great because if it doesn't work, and I think I had told you we were thinking of stopping leads because I got overwhelmed with how many patients were moving forward because it
Yeah.
was a lot more than I had gotten before.
Yeah.
So it works. It's
You
really
guys are
cool.
managing now, though. You're doing well.
Yes. Yes.